And thank you for joining us on this interview about Special Open Enrollment Period taking place in the United States in connection with the COVID-19 public health emergency. I'm here with healthcare industry expert Drew Shockley. Welcome, Drew.
Thanks for having me. I'm glad to be here.
First, for those that may not know, what is an open enrollment period?
That's a great question. Open enrollment, generally tied to health care insurance, can mean a couple different things. First, over 50% of Americans have healthcare coverage through their job. So open enrollment is typically that time period when you shop and enroll in your coverage for the next year. If you're on Medicare, you have an open enrollment period when you can choose a new plan. But specifically what we're talking about here today is individuals and families and Americans that are retired or are self-employed or 1099 independent contractors that purchase their own insurance. Generally, the open enrollment period runs from November 1st through December the 15th of every single year. However, this is why we're doing this interview. There's a special open enrollment period going on right now.
And what makes this open enrollment period so special?
This open enrollment period is unprecedented. Part of the COVID relief bill was an opening of the federal marketplace where insurance carriers offer Affordable Care Act compliant plans. Certified advisors from all over the country walk individuals and families through an application process to shop and enroll in plans. And as I said, generally you can only do that in a small window from November 1st through December 15th. However, the marketplace has been opened up for this special period, and that's going to run from April of 2021 into August of 2021. And it gives millions of Americans a special opportunity to shop and enroll in healthcare plans.
So it sounds like more people than ever before now qualify for help paying for their healthcare coverage, even those who may not have been eligible in the past. Can you talk a little bit more about that?
Indeed. Additionally, as a part of the COVID relief package was an enhancement to this premium tax credits. Now, if you purchased your own insurance before, you're probably aware of the premium tax credit. And if you didn't have coverage through your job, you weren't covered by Medicare or Medicaid, and you bought your own plan, you could have applied for this premium tax credit. However, before this year, it was limited to specific incomes. So if you were single, your income had to be at or below $48,000. If you were a household of two or married, your income had to be below $68,000. Now, with the passage of the COVID relief bill in April, those income thresholds were removed. So millions of Americans are now qualifying for this enhanced premium tax credits. Those with higher incomes, those that previously did not qualify for the premium tax credit, they're now eligible. And millions of Americans are paying less for healthcare coverage than they did before.
Wow. And who do you think sees the biggest benefit from this expanded plan?
It's great question. I think that it's all across the board because, in addition to the enhanced premium tax credit, even if you're on a tax credit eligible plan today or you're using a tax credit, you may qualify for more tax credit, but you have to speak to an advisor to do the application. That's where a lot of people are confused. It doesn't just automatically apply, to your plan. You have to process a new application to get the enhanced premium tax credit. So individuals that are already on a plan with a tax credit and those that had higher incomes over those threshold limits I mentioned before, they are seeing a lot of benefit as well because now they qualify for a tax credit and their plan costs are reduced, and millions of Americans are seeing this as savings right now.
Wow. So is the special open enrollment period also applicable for those who aren't currently enrolled in any plans?
Yes. Even if you're not insured in a plan today, if you're uninsured, and there are, approximately 9 to 10% of the population is still uninsured. Sometimes they just don't know where to go. They just don't know how to buy an individual plan. But if you're uninsured today, you can utilize this special enrollment period. You can apply for this enhanced premium tax credit, but you need to act, soon. You should search and find, a certified advisor. You should walk through, this application process and see if you can find a plan that is affordable for you and for your budget.
Yeah. And how often do these special open enrollment periods occur?
This is the first of its kind. I've been working in the healthcare insurance industry for the past 15 years. And of course, there have been a lot of changes over that period, but we have never witnessed a special enrollment period like this that is going on, throughout 2021. But there's a limited time. So if you're a consumer out there and you're shopping or you're still interested, you should find a certified advisor and walk through that process soon.
Definitely. And as a reminder for those who are listening, what dates again are this special open enrollment period active through?
So this is 2021. It just opened in April of this year, and it's going to go into August. So there's a short window, but millions of Americans can take advantage of this and find more affordable plans than they've seen before.
Thank you so much for your time today, Drew. Where can people go to get more information on the special open enrollment period?
There's lots of resources. If you are watching this video here, you can see the resources. Come and visit one of the sites that are on this video. Call the phone number, and we would be glad to connect you with a certified advisor.
Thanks again, Drew.
Thank you.